Good morning. So I'm not quite sure what everybody's expecting. So if you've got any particular questions as we go along, feel free to put your hands up and I'll just rattle through a few of the things that I think are important. So if you're contemplating pregnancy, I think the first thing you got to start at is before pregnancy. So hopefully if you can be in that situation, then one of the important things is to optimize any medical conditions that you've already got. So see your GP, start there, and if you've got diabetes, high blood pressure, any other issues, you've got to get those sorted out first of all. The only supplement that's absolutely recommended is folic acid, 400 micrograms a day. Now, most people take a general multivitamin, which includes a bit of iodine and the folic acid, and they're all excellent. And you can take those right before you're pregnant for about 2 months, right through the pregnancy and even through breastfeeding. But the only part of it that's critical is the folic acid. So if you find you can't tolerate the multivitamins, they make you a bit sick or a bit constipated, as long as you're taking the folic acid, you're covered. Don't forget before you get pregnant to check your health fund, because not all health funds are the same. Make sure that you are covered for obstetrics and check that the hospital that you're planning to deliver at, which of course would be the Mater, that they're an affiliated hospital. The Mater is affiliated with all the major health funds, but some of the other hospitals are not. It's important to check dates as well. So most health funds have a 12-month waiting list. Now that's not 12 months before you can conceive. That's 12 months before the due date. Now, the due date's different to the delivery date. So if you fall pregnant 4 months after you take out your health fund, your baby will be due 13 months after you've taken out your health cover, and therefore you'd be covered. If your baby happens to be born 2 months early, and that's only 11 months, you're still covered because your due date was outside the 12 months. Does that make sense? So make sure your health fund works off due date, not delivery date. Make sure your baby will be covered at birth. Now, not all health funds automatically cover you. Some of you may be on singles with obstetrics or couples with obstetrics, and that doesn't necessarily cover the baby. And the specific conditions you've got to make sure are covered are if the baby's born premature and needs to go to the nursery, because that can be quite an expensive bill otherwise. What if the baby's born with any congenital anomaly? Will that be covered, or will there be a 12-month waiting list for that? My third child, I've got about 5, can't remember, somewhere in there. The number 3 was born with a little inguinal hernia. Every time he cried, he had a little inguinal hernia. That's a congenital anomaly. He had to have a little bit of surgery to fix that up. But because we were fully paid up into family level, that was all covered. But if you're not paid at family level, they may say there's a 12-month wait on getting that fixed. And mental health is one of the other ones that people always forget. Unfortunately, postnatal depression is a reality, and if you do end up with postnatal depression, the last place you want to end up with is in a public mental health unit, trust me. Get some private insurance that covers mental health. Thinking about getting pregnant, a lot of women often defer it and say, oh, I've got plenty of time later, I can wait until I'm 30, and you hear about all these movie stars that are having babies at 40 and 45 and whatever. The reality is that your fertility does drop off precipitously after about 30 to 35 years of age. The blue curve there shows you that even a perfectly fit and healthy 25-year-old only has slightly better than 20% chance of conceiving on any given month. And that's why it's not always possible to get pregnant the first month you try. But you can definitely see that by the time you're getting down to 40, your chance of getting pregnant is down to about 5% per month. So it's important not to leave it too late. If you're in your 30s or you're getting near there and you're contemplating just holding off a bit longer, it's good to go and talk to a doctor and find out what your status is. We can do tests to see what your egg reserve is. We can check your general health and fertility, and we can give you some advice about whether that's an appropriate thing to be doing or whether you really should be taking some other steps. There's other things that can be done. It doesn't automatically mean jump in and have a baby now, or maybe we can freeze some eggs. There's all sorts of other options that are available. But the trick is not to leave it too late so that you end up being disappointed and going, damn, I wish somebody had told me before. So when you do get pregnant and you decide to come to see the best private obstetrician in town, what sort of care can you expect? The important thing is with a private obstetrician, it's right through the entire pregnancy. So you're not mixing and matching, seeing different healthcare. You're not seeing a midwife this time and a GP next time and a doctor at the hospital next time. You just see the one person right through. I like to see my ladies nice and early at about 8 weeks. I think it's good to get in nice and early. You can establish the heartbeat, confirm the pregnancy's all good, establish your dates, make sure they're right, do a full health checkup and work out any issues that might need to be optimised early on. It's a bit late if you're showing up at 14 weeks and we find out that, oops, you've already got diabetes or something and we didn't get that sorted out early enough. There's a new test that's available now at 10 weeks for testing for Downs. It's called NIPT, or Non-Invasive Prenatal Test. It's working on the basis that the baby is in there making and breaking cells already. Every time it smashes a cell open, some of the cell DNA will get into the mother's circulation. And at 10 weeks, we can do a blood test on the mother and we can detect that DNA. And that can tell us whether your child's got Downs or not. And it's quite accurate, much more accurate than any of the other tests, and it's available nice and early. And if you want to know, we can also tell you the sex of the baby. At 12 weeks, we do a scan. It's called the first trimester ultrasound. It used to be called the nuchal translucency, and it was your test for Downs in the old days. But nowadays, the NIPT is a better test. We still need to do a scan at 12 weeks just to make sure that, although the DNA might be right, we want to make sure the baby's been constructed correctly. So you want to make sure it's got one head, two arms, two legs. Once you get past that 12-week test, you can be very reassured that your pregnancy is going to be quite normal from that point on. At 20 weeks, they do a very detailed, very long morphology scan. If you haven't been for your morph scan yet, I'll already tell you, it takes over an hour, and they spend about half their time just looking at the heart. So if you seem to be in your scan and they're spending half their time looking at the heart, don't imagine there's a problem with the heart. It's just that it's the most complex part of a baby to examine. Everybody should have a check for diabetes. In the old days, we sort of did risk screening. So if you had particular risk factors, we'd screen you. We now find that everybody should be screened for diabetes, and we do that at 28. At 34, it's a good time to start doing antenatal classes. They're fairly irrelevant before that, but as you get to 34 weeks, that becomes very pressing, and you start to go, yeah, I really want to know about this. The most important part of your antenatal classes is actually the breastfeeding class, the breastfeeding part, because that's the part that's actually going to occupy most of your time the minute this baby's born. Most people focus just on the birth, but don't forget to focus on the breastfeeding side of it. We do other tests at 37. We look for group B streptococcus. We do all sorts of other things. And the idea is that you'll get regular visits from the one person who follows you right through and knows your whole history and can pick up any changes that happen. Any tests that are ordered are followed up appropriately, and things don't fall through the crack. When you actually come for delivery, if you're with a private obstetrician, you'll present to the hospital, you'll be in labour, the midwife will help look after you, and if there's any problems or complications, the obstetrician attends. The obstetrician otherwise will just attend at the moment of birth, and they're there for the second stage of the birth. I actually catch 97% of my own babies, so I don't miss many. So if you're with a private obstetrician, you will find that you get that one-on-one care right through to the end. Nobody can work 24/7, so we all have some sort of on-call arrangement. And most of the groups in town are backed up with other fully qualified obstetricians. So there's a small chance that you would get one of our colleagues to deliver your baby. The beauty of having a private obstetrician is that we don't have to transfer you out if anything changes in the labour so if you're halfway through the labour and we go, oh, hang on a minute, there's a problem, you don't have to go to somebody else. We don't have to send you off to a more experienced person because we are the top of the tree in that sense. Anything that arises in the labour, anything that's required can be handled. So if you need an instrumental delivery, need a cesarean, if you have a bleed, if you have a tear, if anything bad happens, we can handle it all. So you get the same person that you've known all the way through, takes you right through whatever complications can occur. The beauty of also having a private obstetrician, we come along with private paediatricians, and it's important after the baby is born to make sure that the baby is thoroughly checked out properly as well. Often, unfortunately, in the public hospitals, you get very junior doctors doing the baby checks. And while they're very good, there's no doubt that a private paediatrician will pick up more subtle things in your baby. Postnatally, if you're going private and seeing a private obstetrician, you get a longer stay in hospital. In the public hospitals, they've often got 4 to 12 to 24-hour discharge plans. And the problem with that is that your milk doesn't come in for 3 days. So when your milk comes in on day 3, you're already back at home and you haven't got as much support or help. So having a private care means that you get to stay longer in hospital, more support from the midwives afterwards. You get a daily visit from your obstetrician and a daily visit and check from your paediatrician. So we know that your baby's very healthy. We know that you're on track with the breastfeeding. We know that you've got all the parent crafting all sorted out. And we know that you're going to do a much better job when you get home. Why would you choose the Mater Mothers as opposed to any of the other hospitals around town? The two big things are safety and quality. There's no doubt the Mater Mothers is the safest hospital in Brisbane. It's the only private level 4 nursery in Brisbane. The only other level 4 nursery is the Royal Hospital. Every other nursery at every other hospital takes well babies at 34 weeks, or they can take sicker babies if they're a bit older, but well babies from 34. So if your baby's under 34 weeks, it has to go to either the Royal or the Mater. And the Mater's the only private one. If you're seeing a private obstetrician at the Mater, then again, they can handle whatever happens to you and your baby all the way through, and you don't have to go anywhere else. If you're at an outside hospital and you have problems before 34 weeks, your baby has to get transferred, or you have to get transferred to another doctor or to the public system. We also have 2 fully staffed operating theatres 24/7, which is the only hospital in Brisbane that has that. Now, that may not seem relevant to you, but if you're suddenly at 2 o'clock in the morning and something catastrophic happens, you need to know that we can do something quickly. I had a lady who was having a second baby. She had a completely normal first birth. She was in labour with the second one. She was only about 3 centimetres, going along quietly, expecting everything to be perfect. And I said, well, I'm just going to duck home and put the kids to bed. I got a phone call when I was at home, and they said, your lady's bleeding badly. So I jumped up, put my shoes on, grabbed my keys, got in the car, drove to the hospital, went inside, said, yep, you're bleeding heavily, you need a Caesar. Went down, anaesthetist saw her, I got changed, scrubbed, gowned, cut, delivered the baby. Couch to baby born was 14 minutes. And you can't do that at any other hospital in Brisbane other than the Mater, because everybody's on site already. You just make a few phone calls, you activate the team, and it all just happens. And that's where the Mater's got the edge. It's got that safety edge. Got a full range of any other backup services and ancillary services you might need. And they just do more private deliveries. And if you do more of them, you're going to be better at it. The Mater does more than just about all other hospitals in Brisbane combined. We've got a new building, quality finishes. You get a partner's bed, you can stay over, partner's meals. We've got new menus now, room service menus. And every room there is a single room with an ensuite. So there's no other choice. So why do you choose a private obstetrician? Why do you come to the Mater? Continuity of care, thoroughness with all your testing, follow-up of all your results. You never have to have your care transferred to another hospital or another healthcare provider. We deal with the low and the high risk, and it's very important to understand that an uncomplicated pregnancy and an uncomplicated delivery are retrospective diagnoses. It's only when the whole game's over you can look back and go, oh, that was all low risk. So until that moment, you don't know whether you're definitely going to be all low risk all the way through. Thank you very much. That's my 5. And that's Thursday at Churchy. That's my 11-year-old driving the Cookie Monster billy cart at the Churchy Grand Prix. He won best themed cart, but wasn't very aerodynamic, so they didn't win fastest. Any questions from anybody? Any questions at all? Nobody? Everybody's happy? Great. Hope you're all having a great day. Enjoy your time here. Grab lots of souvenirs. Have lots of happy, healthy babies. Bye now.